In this video, we'll explain the 4 most common types of keto side effects, why they happen, how long they usually last, and most importantly, how you can prevent or manage them effectively. To begin, let's look at the most common keto side effects and explore why they occur in the first place. When your body switches from burning carbohydrates to burning fat, several temporary effects may occur. One of the most frequent is the so-called keto flu. These are mainly caused by shifts in electrolytes and water loss triggered by lower insulin levels. Some people also experience changes in cholesterol levels, especially an increase in LDL. This usually results from fat being mobilized from storage and may also be influenced by genetic factors, such as specific variations in the ApoE gene. To manage this, focus on increasing fiber intake, choosing unsaturated fats over saturated ones, and regularly monitoring your lipid profile. In addition, a few individuals may notice changes in heart rhythm or blood pressure. These are rarely due to dietary fat, but are more often linked to mineral imbalances, such as low magnesium or sodium, which affect how the heart and blood vessels function. Replenishing electrolytes with magnesium, potassium, and sodium supplements, especially during the first few weeks, can help stabilize heart function and blood pressure. Among all the side effects, keto flu is by far the most common. Let's take a closer look at what it is, why it happens, and how to prevent or manage it effectively. Keto flu refers to a group of temporary symptoms that many people experience during the first few days of a ketogenic diet. It is not a true illness, but rather a natural response as your body adapts to using fat instead of carbohydrates for energy. The main cause is a sudden drop in insulin levels. When you reduce carbohydrate intake, insulin production decreases, prompting your kidneys to excrete more sodium and water. This leads to electrolyte imbalances and mild dehydration, which are the core drivers of keto flu. As a result, you may experience fatigue and brain fog. This happens because your brain is used to running on glucose, but ketone production hasn't fully ramped up yet. To ease this transition, start increasing your electrolyte intake a few days before going keto, and make sure to stay well hydrated. Drinking at least 2 liters of water daily and adding sea salt to meals can support steady energy and focus. Headaches are another common symptom, often caused by dehydration and low sodium levels that affect blood vessel function. Bone broth and electrolyte-rich drinks can help restore balance and relieve this discomfort. Muscle cramps typically arise from losses in magnesium and potassium, which are essential for nerve signaling and muscle contraction. To prevent this, incorporate magnesium-rich foods like spinach, avocado, and pumpkin seeds into your diet. If cramps occur, topical magnesium oil can also provide targeted relief. Some people feel nauseated or lightheaded, especially if fat intake increases too quickly or blood pressure drops due to fluid loss. Gradually increasing your fat intake over the first few days gives your digestive system time to adjust and helps stabilize blood pressure. By understanding these root causes and responding with targeted strategies, you can reduce or even avoid the symptoms of keto flu. Preparing your body with electrolytes, staying hydrated, and easing into fat adaptation all make the transition to ketosis smoother and more manageable. Now that you understand what causes keto side effects and how to manage them, it's helpful to know when these symptoms typically appear and how long they last. Most side effects follow a predictable timeline. On the first day, your body starts using stored glycogen, which also causes water and electrolyte loss. Between days 2 and 4, symptoms often peak as sodium and magnesium levels drop. By the 5th or 6th day, symptoms usually begin to fade as fat metabolism improves and your body starts producing ketones more steadily. By the 2nd or 3rd week, most people feel more stable, and energy levels return to normal. If symptoms last beyond 10 days or interfere with your daily routine, it's a good idea to review your food intake, hydration, and supplement use. Keto side effects can be uncomfortable, but they are usually temporary and manageable. By preparing your body ahead of time, staying hydrated, and supporting your electrolyte levels, you can ease the transition and stay on track. Always speak with a healthcare provider if you have underlying health conditions or if symptoms persist.